Well, good morning, good afternoon, good evening, wherever you are in the world. Welcome to the follow-up video to my eye surgery that I had in Lahore, 6 months ago now. Now, I didn't mean to shoot this video so late. It's been about 6 months since my surgery. I meant to shoot this video in May. I actually was looking myself again. My eyes had fully recovered in May, which was 3 months after my surgery. However, due to bad heartbreak, I sort of went into burnout mode with my channel and I wasn't producing any videos the past few months, but I am out of that. Wanted to share all of what I didn't share in the first video with you. Now, if you haven't seen the first video, that goes into how I found Dr. Sheraz, who performed the surgery, what steps we had taken prior to that, etc., etc. In this video, I'm going to share very graphic photos that were taken of the surgery. So there'll be a spot where I tell you if you don't want to see those photos to skip forward. But I'm going to share that and share some other before shots of how just big my eye bag was on my right eye and just general aged puffiness of my left eye, but I'm going to share more and in detail with you. First of all, I wasn't planning to wear a beret on this shoot, but this just arrived by courier this morning from the Balochistan levies. It was a gift from them, and I just can't seem to take it off. It's super cute. I love it. So hence the beret in this video. Now, I do want to give a big shout out to Dr. Sheraz and his teams, both at his clinic and at the hospital. I've been very happy with the results of my surgery. I'm writing a book, or I'm starting to write a book about my time in Pakistan. So I feel like I'm thinking of Dr. Sheraz every day lately because I'm documenting my past almost 9 months here in Pakistan. And I met Dr. Sheraz on day 3 of my trip here in Pakistan, and he's played a huge part in my life. Since then, became a friend, someone I used to talk to every day and message, especially around the surgery times and afterwards. And his team was always very kind as well. So I just want to say thank you to everyone for everything. All right, now let's get into this. Now, I'm 50 years old. I turned 50 last October. And when I did, I treated myself for the first time to Botox right here and to under eye fillers. And basically, before I left Indonesia, my face looked great. I'm putting images here of this is a few hours after I had the fillers and just a week-ish before I left for Pakistan in November. Now, what happened was, this shot that I'm showing you is at the airport lounge in Kuala Lumpur. Something was already starting to happen and swell with my eye halfway through my trip to Pakistan. Now, once I arrived to Pakistan, it was fully swollen. I was starting to really freak out. And basically, day 3 I was here. We had our first video chat, and he's in Lahore. I was in Islamabad at the time at the Serena Hotel, and basically I needed to wait another almost 7 to 10 days to get to him. And when we did, we thought, okay, let's take out the fillers, put in new fillers. That didn't help. It didn't take away this new right puffy eye. And I'm showing you now a bunch of footage from the time that after we took out and put in new fillers until I went back for surgery with Dr. Sheraz. You can see it doesn't look great. I look really, really old, and much older than before I left for Pakistan. So it's amazing actually what your under eye area does for you from having eye bags to not eye bags. It's quite incredible. Kind of makes me curious about other things that you can do from a cosmetic surgery standpoint. But I feel like that's a dangerous path to go down, starting to think about other other things. Anyway, in my first video, you see up to about, I think the third day is when I stopped shooting. Third or fourth day, so you see my recovery there. Basically, I stayed here at the country club that I stay at in Lahore. I was here for 2 weeks, and Dr. Sheraz is a member, so it's great. I actually see him quite frequently. He came and let me interview him, and he showed me personally like how to do the massages and the like the post-op treatment that I needed to do. About 10 days after my surgery. Okay, now after that, I ended up making a huge mistake. I was leaving from here at about 2 weeks, like the 2-week mark from my surgery. And I think if I had stayed maybe if I had stayed in a safer environment for another few days, maybe a week, I would not have any scarring right now. But I ended up going to the Cholistan Desert Rally, and I was glamping in a very posh tent village owned by friends of mine that had Western toilets, and I had a heater in my tent, and there were chefs and people attending to us, and it was great. But because I was getting very fine dust and dirt into the stitches of my eye during that entire week period that I was in Cholistan, and it was very cold in the morning and at night, I wasn't washing and caring for the eye area as much as I should have been. And so what happened was that area ended up getting slightly infected, and I ended up, like, it swelled in both eyes. After I left Cholistan, it started the day after. And if I squeezed, like, blood would come out. It was quite gross. This had nothing to do with Dr. Sheraz or the sutures or any of that. This was me not tending to my fresh wounds well enough and not cleaning them properly each day. So that is completely on me. And as you'll see in just a second, like, that is the only thing. Well, let me show you right now something I shot a little bit earlier so you can see what my eyes look like now. Okay, am I in focus? Yes. All right, now this is indoors. I have curtains drawn. I just thought I'd show you like how good, dang, how good my eyes are. Like, what hold on. What a night and day difference from before my 50th to when the crazy stuff started happening with my big, insanely huge right eye, all of that. So it's so good. And if it hadn't been for me not cleaning my wound and the stitches well enough when I went to the Cholistan Desert Rally, I would not have these. I only have, let me see if you can see. Not sure, there's just 2 little bumps here. See, it's just where the stitches were that were affected by the dust getting into them during that long week camping, glamping. Okay, so that was a little clip from earlier. I was actually standing in front of the window. I now have a light on, but my eyes look fantastic. And it has been 6 months, but like I said, I wanted to shoot this in May. I just didn't have the heart to do it. But my eyes basically look the same as they did in May. So that was 3 months. Now, I did think my eyes would look better sooner, but they sort of like, the way that the eyes stretched back to shape, because my eyes, I don't have the biggest eyes, but they're not completely small. Hold on, can you see me? Am I focus? Yeah. But there was a definite shape change to my eyes for quite some time. And I thought that that would end sooner than it did, but at about 3 months, I did look back to myself again. Like, on video, I look like me. The image in the thumbnail, the after shot, is from May in Balochistan, my last Balochistan trip that I did this year. And it was amazing. I really felt good about, like, I looked myself again, but like 8 years younger. I think I'm like 42 again, 44. I don't know. Maybe I'm being over generous with myself, but the job that they did was wonderful. The costs and all of that are in the other video, but basically this will cost you between 150 and 200,000 rupees, which is, I think, around like 850 or 900 US dollars to $1,200, something like that. But if you're thinking of having surgery, I highly recommend Dr. Sheraz. I am going to put a clip of Dr. Sheraz explaining exactly what happens during the surgery here to close out the video. But I highly recommend Dr. Sheraz and his team. I'm really, really happy with the results of the surgery. He's a really nice guy. You'll feel in very good hands. There's something very soothing to how he explains things that kept me quite calm, especially in the beginning when I first rolled into Pakistan. And I was really, really freaking out because I had never had such a big swollen eye before. And although what we didn't fix it in the beginning, it was still very calming to hear someone, you know, there who just kind of is taking control of, like, mentally getting me not so afraid of what was going to happen and just know that there were solutions to things. So, yeah, I'm going to let Dr. Sheraz finish out the video. If you have any questions, feel free to leave a comment down below. I'll try and get back to you. But I would highly recommend going with Dr. Sheraz and his team for any cosmetic surgeries that you do. He has a really weird Instagram account. Sorry, Dr. Sheraz, but you do. It's not something I would ever do for clients of mine. I'm a digital marketing expert by day. This is my nighttime gig. Well, this is my hobby, basically. But he shows you exactly before and afters, like in the surgical room before and after, not pretty before and afters like I've shown you, like right here. So if you have any desire to see before and afters of surgeries on Instagram, I'll put a link to his Instagram account down below, guys. But do follow him, do give him a call for a consultation. You can do a video chat if you're from outside of Pakistan and then come in for medical tourism. He makes it all very, very easy. All right, well, I'm gonna let Dr. Sheraz finish this out. I will see you guys in the next video. Ciao.
Angela, you know me quite well by now. I'm Dr. Sheraz Raza. I'm a plastic surgeon, a cosmetic surgeon, and a hand surgeon, to be very specific about it. I have trained in Pakistan, in Singapore, in Holland, UK, and US. And I wouldn't go in details what exactly I have been trained in, but I'm micro and super microsurgery, and I specifically do upper limb reconstruction and nerve reconstruction as a morning job with my government hospital. And my private practice is almost completely and exclusively cosmetic. Yeah, so cosmetic surgery is something that is very near to my heart, and that's why obviously you came to me. First of all, it's a pleasure having you over. So Angela, first of all, I'd like to explain to you what exactly is lower blepharoplasty, what we do, why do the bags happen, and what needs to be done for them. So it's not just aging. Sometimes in general, sometimes you're traveling a lot, sometimes poor eating habits, sleeping habits, dehydration, and all these things, sometimes they make not just the skin, but the whole tissue is a little weaker. So we have skin, underneath it is a muscle, and underneath it is a layer that we call septum. And septum, the role of septum, it is attached to the bone and it is attached to the eyelid. So the purpose of this structure is to prevent anything that is inside the eyeball bulging outside. So as long as it is very taut, it keeps everything behind. But once it becomes a little looser, a little weaker, it kind of starts protruding and bulging out. It doesn't totally break through, but it bulges out. So the whole concept of this eye bags is that it bulges out. So when it initially starts to bulge out, it only produces a very small depression, what some people explain as a dark circle. Some people call it a tear trough, and we also call it a tear trough. So this depression is the first sign of having this bag. And when it's just this much, then we can make it better by injecting something, like reinforcing it, injecting something very deep in the form of fillers or fat, and sometimes even implants. But as it becomes more and more so severe, for whatever reason, the same reasons that it happened the first time around, then we kind of have to correct it. And by correcting, I mean we have to make it tight again, so that whatever is inside doesn't look outside. So the old concept, when we thought that the fat is becoming more and more in the eyeball and we have to take it out, and it's pretty much gone now. So we try not to take out much, if at all anything, from fat from under the eyes, and we try to readjust it in the same area, because an empty or a hollow area would also not look very nice. So we want it rejuvenated, fresh and healthy, and a nicely looking. So that's exactly what blepharoplasty is, that you go under the skin and muscle, separate everything up, and down there, the septum that has become weaker, you kind of reinforce it and reattach it on the bone.
How do you reinforce and reattach?
So ideally it is attached to the margin of the bone, but now what we do is that we release all these attachments and we go deeper and we make a layer and we attach it to the bone with suture stitches. And we take the fat along with it, so it becomes a smoother contour rather than suddenly again eye ending here and cheek starting here. So we do not want a sharp contour. We want this to be a smooth transition between, and that is basically all there is to plastic surgery, a smooth transition from one part to another. That's all the concept of beauty.
The photos that I have of the surgery.
It's difficult to perceive, because in medical books when we used to read a lot, it was, even we didn't perceive that you have a bone inside and one layer coming on top of this bone, other layer coming with this bone, and this continuing and getting attached to the margin of the eyelid. It sounds like not a very, very strong construct, but apparently it is. That's how nature has made all these structures. It's true for everything in the body. So yeah, I think surgery has a music to it. When you see structures in harmony, that's the whole thing to me. That's the whole idea. I personally have a liaison with a bariatric surgeon, a gastroenterologist who does intragastric ballooning for weight reduction surgeries, an endocrinologist, because that is another thing that has really come up in recent years, the gender dysphorias, people not being happy with their genders or having psychological distress because of that. And countries like Great Britain, they have started labeling it not as a psychological disorder, but an actual normal thing. So that's what we deal as well. We have a whole committee, a psychiatrist and everything. So yes, in bigger cities, we are all dealing with that. For example, I personally have my patients travel from, for example, in last month, in December, despite of COVID and everything, I had my patients travel, one of my patients traveled from South Africa, 2 patients from Canada. I had 2 patients from US. I have a lot of patients traveling from Italy and UK, and I do get a lot of patients from Middle East, UAE. So one of the destinations is Turkey, where people really like to travel for medical tourism. But I just perceive by my own experience that recently we are kind of rising up as another market where people would like to come up, and our work is being appreciated recently.
The patients that you've had from these countries you mentioned, is there a lot of tummy tucks? Are you now getting?
I do get tummy tucks and rhinoplasties.
And rhinoplasty.
These are the 2 things that really travel all the way from. And the tummy tucks means full body sculpting, mommy makeover time kind of a stuff.
What?
Where you do arms, thighs, breasts, tummy, back, buttocks, everything. You lift them, so you give them a complete renewal of themselves, and it really helps their self-esteem, and they go back very happy.
What's the recovery time on rhinoplasty, and what's the recovery time on a body sculpture?
For me, if you're talking about when can a person travel or travel back, so for me, for rhinoplasty, 1 week is a good time to travel back, because I take off the solid splintage and stuff. a few stitching stay, but the person can handle them well. And in tummy tuck, I ask them to stay for at least 10 days, so that I'm around for if something if some happens, or I have to have a look at them. So I like to have a look at them at least at day 10 before I ask them to go ahead and go back.
Okay, what is it normally for lower eye blepharoplasty? Because obviously I was a baby and stayed 10 days, 11 days at this posh little place.
So I think you can tell better than I can, but I think for traveling back, I think you were good enough in 5 days to travel back, weren't you?
Probably.
Yeah, I think 5 is a
sutures.
Yeah, I think the sutures, because I put no absorbable ones, so I do not remove them, so they do not have to stick around for the stitches themselves actually, per se. And bruising, usually with the regime I gave you and the regime that I usually practice, swelling and this bruising, that gets quite better in 5 to 7 days. It's a good time.
Yeah, it's a good time.
Yeah.
I appreciate everything. You just made me feel so calm from the very first video call back in November when I first traveled to Pakistan, and all the way through until today. Just
I think we are very happy to have you here. I hope I wish you the best for everything in future of your life.
Thank you.
It's basically, I think that's the cycle of a plastic surgeon. You cannot leave a job incomplete. You have to carry it through. So that's exactly. So I haven't done you any favors. It's just that because your eyelids are my babies now. so I had to take them through. Yeah.
They were in very good hands. I look 42 almost.
No, it's going to get better. It's going to keep getting better. Just the same example. It's just like sand in the paper, and it will keep settling itself.
Hold on. I'll sit back down for a second. Okay. All right. Thank you so much.
Pleasure.